Hi guys, welcome to my YouTube channel. So today we'll be discussing the obstetrics topic, that is ultrasound in pregnancy. And in this topic it's not so important, but there are 2-3 questions which can be asked in your viva, and this is a topic which needs something to write upon because it's not given so good in the books. So I've prepared a PPT which also lists down all the brief topics. So without any further ado, let us start this topic with a very good quote, that is, the best way to predict your future is to create it. So ultrasound in pregnancy, that is an obstetrics topic, and we'll be discussing the first trimester and the second trimester ultrasounds, indications, and the components of ultrasound, the types of ultrasounds, and all these things. So before any imaging in obstetrics, benefits and safety of the different modalities, that can be ultrasound, MRI or CT, they must be carefully considered because pregnancy is a high risk state. So we have to see the risk benefit ratio, that whether we should go for it or not, and what type of radiological investigation should we go for. So ultrasonography is the preferred modality of the initial imaging for the evaluation of a pregnant woman with abdominal pain. So the preferred out of all these radiological investigations is the ultrasound, and ultrasound is the most valuable diagnostic tool in the pregnancy, and it is safe. The optimal timing for a single ultrasound examination is at 18 to 20 weeks. So what are the types of ultrasonography? It can be transabdominal ultrasonography, that is a TAS, and transvaginal ultrasonography, that is TVS, Doppler ultrasound, and the three-dimensional ultrasound, that is a 3D scanning. So these are the types of ultrasonography. Now this question has come many times in exams, in university exams, and it's not given so well in the books. So this is the table I have prepared from 2 or 3 sources, and you can take a screenshot of this slide and write it as it is. So the question come as, what are the ultrasonic landmarks and their occurrence and in the weeks of gestation. So the ultrasonic landmarks and their occurrence in weeks have been given like this. So gestational sac will be seen at 5 weeks, detection of fetal life can be done at 7 to 8 weeks, placenta 8 to 10 weeks, fetal head 11 to 14 weeks, yolk sac 5.5 weeks, fetal pole and cardiac activity can be seen at the 6th week, then lower limb birth 7, upper limb 8, and spine choroid plexus 9. So components of basic ultrasound. So components are being divided into the first trimester and the second and the third trimester. So what are the components of a first trimester ultrasound? What we'll see when we'll do the ultrasound in the first trimester of the pregnancy? We will see the gestational sac location, the embryo identification, the crown rump length, which is a very important, fetal heart rate motion, fetal number, like multiple pregnancies can also be there now, and uterus and any adnexal mass evaluation. In the second and the third trimester, we will see the fetal number, presentation, the fetal heart motion, the placental location, the amniotic fluid volume, gestational age will be confirmed, any fetal anomalies, and evaluation of a maternal pelvic mass. So what are the indication of the first trimester ultrasonography? This is very much asked question. So the indications are intrauterine pregnancy, suspected ectopic pregnancy, vaginal bleeding, fetal anomalies, suspected molar pregnancy, gestational age confirmation, multiple pregnancy, and to confirm the cardiac activity, please, sorry for my mistake, it's activity, screening of aneuploidies, and evaluation of any pelvic or adnexal mass. So these are the indications of the first trimester. So let us do the first trimester in some little bit of more detail. So definite diagnosis of intrauterine pregnancy is possible as early as 29 to 35 days of menstrual age. And the true gestational sac is eccentric in position. The embryo fetus or the fetus pulsation, viability, location, all these things are seen in the first trimester USG. Double decidua sign can also be seen, that is due to the interface between the decidua and the chorion. Presence of yolk sac or the fetal pole within the gestational sac confirms pregnancy. So this is the line which confirms pregnancy, which we see in the ultrasound. That is the presence of the yolk sac. True gestational sac size, true gestational sac size increases 1 mm per day. Pseudogestational sac or the pseudosac. What is this? It's irregular in outline. It is usually centrally located in the uterus. It has no double deciduous sign and the sac remains empty. And the embryonic cardiac activity is also seen. So these are the things which are done in the first trimester. Also, the gestational age in days can be calculated by 42 days plus the crown rump length or 30 days plus mean sac diameter. So these are the two formulas of calculating the gestational age. The biparietal diameter, that is the BPD, femur length FL, head circumference HC, abdominal circumference AC. These are the commonly used factors which are used for dating. Transcerebellar diameter, that is a TCD, is an accurate predictor of the gestational age when measured between 14 weeks and 28 weeks. IVF pregnancy is dated by the date of embryo transfer minus 14 days to get the last menstrual period and to calculate the expected date by Naegeli's rule. So these are some formulas and some more detail about the first trimester USG scan. So these two slides and the components and indications of the first trimester. So these are all the things you need to know about the first trimester ultrasound. Now let us come to the ultrasound markers for fetal anomalies. So what are the ultrasound markers? That is a nuchal translucency, which is the increased fetal nuchal skin thickness more than 3 mm by the transvaginal sonography, is a strong marker for chromosomal anomalies like trisomy 21, 18, 13, triploidy and Turner syndrome. So nuchal translucency is a very good marker. Multiple pregnancy, we'll see 2 gestational sacs, and an embryonic pregnancy and ectopic pregnancy, there will be absent double decidual sign, pseudogestational sac will be present, and presence of echogenic fluid in the pouch of Douglas. So these are the things which can be seen, and these are the markers of the fetal anomalies. And hydatidiform mole, we'll see the characteristic snowstorm appearance. Now let us come to the second and the third trimester. After this slide, we'll be seeing all the ultrasound images, because in nowhere, not even in Google, not in books, it's not given very well. So I've taken down many ultrasound images and I've put this in this slide for your benefit. And there are many ultrasound images I've put in the slides, and I'll be providing this PDF in my Telegram channel, whose link which will be given in the description box. Okay, so you can go and download it from there. Indications of second and third trimester ultrasound, will be seeing the gestational age, the cervical insufficiency, any suspected multiple pregnancy, the Leica volume, that is poly or oligohydramnios, placenta previa and abrasion, very important, any suspected uterine malformation, the cases with premature rupture of membranes, very important, the fetal growth rate, fetal presentation, if breech or face presentation is very important, fetal well-being assessment, that is the BPP assessment, and the screening fetal anomalies, and as an adjunct to amniocentesis and chordocentesis. Okay, these can also be done besides this second and third trimester ultrasound, and we can also see the uterine size. So all of this is done in the second and third trimester of pregnancy. When we do an ultrasound, these are the indications, these are the things we look for. So you can see the pseudo gestational sac. This is not a true gestational sac in this. And the double decidual sign, it is a useful feature on early pregnancy ultrasound which distinguish between the early intrauterine pregnancy and a pseudogestational sac. It consists of the decidua parietalis and the decidua capsularis. So as you can see, this is the double decidua sac sign. Then the longitudinal view of the uterus during the transabdominal ultrasound. This is the view, and we are seeing the uterus length. And this is the endometrium, and this is the longitudinal view of the uterus during the transvaginal ultrasound. All these images are difficult to understand, but this is just, I have put it for examples, like this is how they are given. This is the umbilical artery Doppler, which tells us about the blood vessel studies. And this is an embryo 4 weeks. This is 2 gestational sacs which each containing a yolk sac. So this is multiple pregnancy case. You can see 2 gestational sacs. Now this is the evaluation of uterus in any adnexal mass, and this is the uterus and the cervical plug. This is the measurement of the nuchal translucency. We are measuring the thickness of the nuchal translucency. And this is twin pregnancy. As you can see, there are 2 sacs and 2 yolk sacs. And fetal life, number and presentation, amount of amniotic fluid, all these can be measured. This is the amount of amniotic fluid. Now this is biparietal diameter, the BPD diameter, and this is how it's measured itself in the computerized ultrasonogram. Now this is the femur length. This is being calculated, and these are some things which are important to measure, like the crown lump length, the fetal, the femur length, the head circumference, abdominal circumference, the BPD. This is the image of an embryo, and the crown lump length is measured like this from the head to the feet area. This is the whole crown lump length. Then again the crown lump length, and you can see a subchorionic hemorrhage. So these are only the examples of many types of ultrasounds and many anomalies which I could find on the Google and books. So this is a marked labeled image, the nasal tip, the skin, the nasal bones, diencephalon, and the nuchal translucency thickness. All these are and can be seen in the ultrasound. You can see this is an early gestational sac, and this is the gestational sac, and this is the yolk sac, and this is an empty gestational sac. Okay, so it can also be occurring in ectopic pregnancies also. So this is a snowstorm appearance, which is a characteristic of herediform moles. As you can see, it looks like a snowstorm. And this is fecal echocardiography, in which we are observing the. So this is from the book. These screenshots are from the book for very easy to screenshot and learn. The indications of the first trimester ultrasonography given here, and the indications of the second and third trimester ultrasonography given in this table. So this is the full summary of the whole PPT, and these are the most important topics: indications of the first trimester, indications of the second and third trimester USG. These are the questions which can be asked from this topic, and if you just learn this table, it's more than enough. So thank you for watching.